Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban. And as always, we have a very exciting and educational podcast for you today. I'm very lucky because I think the podcasts are that much more interesting, that much more helpful when we have patients who come on and help us guide us through the journey of the topic we want to talk about. And today we have one of my favorite patients, Naomi, who has blessed us with her presence all the way from up north to be here to discuss a few topics, actually. The main topic we wanted to talk about was lip lifts, which if you are on social media at all, you know you've seen hundreds and hundreds of pictures of lip lifts. And if you haven't and you have no idea what I'm talking about, then you definitely want to listen because I think it's super interesting and worth your listen. In addition, we want to talk about facial harmony, the concept of facial balance. Okay, so you're going to definitely want to tune in. So let's start. Naomi, how you doing?
I'm good. How are you?
I'm fantastic. I always love seeing you, your beautiful face.
Thank you.
Thank you for joining us. And as always, first thing is kudos to you, right? For having I always say courage because, you know, plastic surgery is nowhere near as taboo as it used to be. If anything, my wife always talks about how the new generation almost uses it, posts their photos as a sign of status. But for us, a little bit older generation, it's still a little bit something we keep private. So whenever I have a patient who is courageous and was willing to come, chat, discuss, talk about their experience, I'm so grateful because yeah, I can tell you everything you need to know, but it's never the same if you hear it from someone who's actually gone through it. So let's just make a deep dive. The first topic or the first half, we're going to talk about lip lifts. So did you know about a lip lift before we did a lip lift?
Yes, I had seen it on social media, actually. That's how I got interested and did all my research and got obsessed.
Right. So it's like I said, social media is very powerful and it actually has exploded this particular procedure. So let's just start out by definitions. Well, let me describe what the hell a lip lift is. So first and foremost, know that very few to no procedures we do in plastic surgery are new. In other words, people think like, oh my God, this thing was just was invented, this lip lifting. No, it's been around for 50, 60 years. It just has a resurgence and a kind of a reignition of popularity. So a lip lift essentially is when we remove a section of skin from the upper portion of the lip right under the nostril in order to exactly what it says, lift the lip. And what it does is it creates a youthful balance, just like eyebrows, just like chins, just like noses. There is a youthful appearance to the relationship of the upper lip and the lip itself. And so what a lip lift was designed to do is certain people have longer distances of their upper lip, that is from the base of their nose to their lip. And in addition, their lips often are smaller in conjunction. So longer lip distance, a little smaller lip. In contrast, you have people who are in this area lucky. Their distance is short and their lips are large. And so one of the things that the lip lift essentially does two things. It reestablishes a more youthful distance or balance, and it actually everts or makes the lips look larger. And so it's really powerful. And so a lot of people are now doing it again because it became popular on Instagram. And so the big controversy with the lip lift is like everything today, it's being arguably overdone. Right? When you take a 22-year-old girl whose eyebrows are perfect, and she's getting her eyebrows lifted to look like, let's say, Bella Hadid or something, I think then we have a problem. When you take a girl whose eyebrows are a little low or sagging, it doesn't matter her age, and we lift them to make it more youthful, I think that's an appropriate use. The same thing is true of lip lifts today. So the lip lift the issue is the surgeon and the patient who are using it a little bit aggressively. So when you're, again, a 22-year-old girl with an amazing lip ratio and you want that Instagram look, that pouty Instagram look, and you don't want to use filler anymore, and you do a lip lift, and now you look like your lip is attached to your nose, I think it's being abused. But in your instance, I thought it was a really great idea. So let's talk about why you considered it, or why we discussed it. What was it that you wanted, or what is it that you noticed?
So I just wanted a more full lip, and I've always had just super thin lips, and I kind of maxed out. The filler was just not giving me the result that I wanted any longer.
So we were doing filler for your lip on occasion, and you and I were having this sort of tug of war where if we injected you with any more lip filler, it wasn't making your lips look larger. It was making you were at the brink of looking more ducky,
Exactly.
right? So one of the problems that people have is when they fill their lips, rather than the red part or the vermilion part being bigger, which is attractive and youthful, if your lips were small to begin with, they start to get a little ducky. And then it doesn't look attractive. They're bigger, but not so nice. So we had this conversation because you kind of got tired of injections, and also you couldn't really inject anymore without it looking a little odd.
Right.
So let's talk about what the procedure was like and what your experience. So you live out of state, right?
I live in Lake Tahoe, California.
Yeah. So you live Northern Cal. And so you and I discussed the idea of a lip lift. And so tell me your experience of the whole concept, like when you thought about it, when you decided to do it, how you went about doing it.
So we set up a Zoom consult. So we started there, and you said that I was definitely a good candidate for the lip lift. So then I kind of wanted to come into the office so you could touch my face and show me kind of what I could expect.
Why did I tell you I thought you were a good candidate? Because obviously what you just expressed is very, very important. Some people are good candidates and some people are bad candidates for a procedure. What is it that we discussed?
So you said that I was a good candidate because the length between my nose and lip was slightly elongated, and that just turning it up a touch would give me that look that I was looking for.
Exactly. You had the room and the need for the procedure. So, I mean, that's really that's it right there. So if someone has very large breasts, they don't have the need or the anatomy for another breast dog. If your nose is already tiny and you want a nose job, you don't have the need or the anatomy. That's just the basic principles of surgery. So you were a great candidate, and you came down and we examined you and we set up a time for us to do the procedure. So tell me how the procedure went so that people can understand what it entails.
So it was very easy. It was very fast. I came in early, met you early, your first patient right in the office. You just applied some numbing. We waited for it to numb, and you did a little snip and stitched it up. And I was right out of the office within, it was like less than an hour. So it was very easy. I flew home that day. It was very swollen, not near as bad as I expected, but luckily put my mask on and I was good to go.
Right. So what you just indicated is important. So obviously you're like, I came in, you numbed me up, snip, I left, I got on an airplane. So that's amazing. So What it is the lip lift can be done under local, meaning I can do it in conjunction with other procedures. I don't know, you're coming in for a chin hug or a facelift or whatever, or we can do it as a standalone procedure, and we do it in the office. I do the markings, and then I numb you up, and I use injections, not cream, and we numb up your upper lip, and you're numb. You feel nothing. And then I do the procedure. It takes about 30 to 40 minutes. And then you're absolutely right. You have tiny little sutures. Your surgery's done. You have minimal pain, a mild amount of swelling, and you go home. And then you come back.
Mm-hmm.
When did I see you again?
It was about 4 days later to take out the stitches.
Right. So I put deep sutures. Every procedure I do, we do the same, which is we put deep stitches that hold everything together for 6 months. And we put superficial stitches, which we put on the outside, which need to be removed within 4 to 6 days. And those are there to make the scar imperceptible and beautiful. So you came back, we removed those stitches. And how long before, I don't know, you saw your family or your friends or whoever, and how long before you felt like you could go and nobody would notice with a touch of makeup, for example?
It was much faster than I thought. About, I want to say 2 to 3 weeks, I was back at work face to face with people. It was a little bit tight. I could notice it, but I felt totally confident going out in public. So
Yes.
it was
So
much
it's
faster.
powerful, right? Two,
Mhm.
3 weeks, you're face to face with people, and here this thing is right in your face.
Right.
So obviously internally you can feel that it's still tight or swollen, but what is important is what does it look like to the guy at the bank? When I'm at the grocery store, are people staring at me like going, what the hell happened to that girl? So it is a very powerful procedure, very quick, and the benefits come very quickly. So let's talk about risks, because this is really what the show is about, right? The show is about what's possible and then what could go terribly wrong. So there's like basically 3 main risks with this procedure. The number one risk is an ugly scar, right? This is a scar that is potentially visible. Where is the scar? It's right underneath the nose in the sill or the base of the nose. We call it a gull wing incision or a bullhorn because of the shape of it. But basically, it hovers along the base of the nose. When executed very well, it's pretty much invisible. When executed crappy, it's visible. It's there. It's right there in the middle of your face. So if you have a crappy scar, I think it's not the best exchange because you get this benefit, whatever the benefit is, but then you have to constantly worry about the scar. What do you think? How's your scar coming along? How long ago did we do this?
So it's been, I think, 5 months.
5 months is a decent time for your scar to start doing. So is that something that you're conscientious about, constantly worried about it?
Not at all. And I wear very little makeup. So it was definitely high up on my risk reward. When I was trying to figure out if I wanted the surgery, because I don't wear a lot of makeup. But no, my scar is very faint, kind of only when I'm flexing my lip can you see it, but nobody else could notice it.
Right. So that's great because, again, if you exchange a terrible scar for whatever procedure, it's arguable if that's a huge gain. The second issue is asymmetry, right? Your lip is all about the symmetry. We know when you look at someone's eyebrows or eyelids or nostrils when one side is asymmetric, let alone their lips. So it has to be executed very, very well. Otherwise, you get asymmetry in the lip. And the last and most devastating complication is over resection. It's overdone. They've removed too much. It is irreversible. Your lip is now essentially glued to your nose. And everyone knows what that looks like when they see it on TV or on Instagram. Everyone knows when your lip is too short, it looks awful. It almost looks like you have a cleft lip in a weird way because it's shortened, and that's what a cleft lip does. And so that is why this surgery should not be taken lightly. Instagram and social media is great because it brought awareness, right? You wouldn't have known this otherwise, but it also creates such a pull, a vortex, kind of like almost like a force that pulls in young people. Like, oh my God, look at her. She looks so hot, this, that, the other. And it's all about angles. And let alone you meet them in person and they look crazy, like literally crazy. And there's no undoing this one. This isn't my breasts are too big. Now I'm going to go smaller. This is, I own this forever. And I'm like a 62-year-old woman that looks like a weirdo. Right. So,
Right.
You happy?
I'm very happy. I will say it's super subtle, but it was just enough to bring my lip up to just give it a little bit of pout, and it matches perfectly with my face.
Right. So that's by design, right? The lip lift can be designed to do whatever we want. It's subtle because we chose it to be subtle. It could have been more aggressive. All I needed to do was what? Remove more skin, and I could have made it more aggressive and more aggressive. And so we choose, and hence that's the taste of your surgeon, whoever's getting it done and whoever does it for you. Between the two of you, you got to kind of get a gauge. You're a professional, you're sophisticated, you're not some young teeny bopper Instagram girl. You wanted something where you could get away with ideally not having to put filler or less filler in your lip And I think that the subtlety of it was something that was important for you and me. So yes, it's subtle by choice.
Right.
Okay, so check this out. We're going to take a break. We're going to come back. And I want you to hear this out. So, Naomi, how old are you?
I'm going to be 38 in a couple
38.
Weeks.
So you're young. By all standards, you're young. And what we did for you was we did an upper bleph, a nose job, a chin aug, and an upper lip lift. So when you state those things to the average person, immediately they're like, oh my God, this chick is addicted to plastic surgery. Why is she going to do that? She's going to look crazy. I mean, if people can see you, because it's a podcast, they can, you're beautiful. So it's not because of the procedures we did. You were beautiful before. So the argument is, what the hell is wrong with her? So when we come back, we're going to discuss the idea of doing one surgery really big versus doing a bunch of little surgeries incredibly subtle, and which is more powerful in terms of making you look balanced. That's the key, balance. So everyone's going to want to tune in for the second half. We'll be right back. Welcome back to the second half of our episode. Me and Naomi are doing a little bit of a journey here, talking about facial aesthetics. We just finished talking about the lip lift, and now I want to talk about a really interesting subject matter. This idea of multiple surgeries, this idea of facial harmony, facial balance. So everything we talk about is a slippery slope. Everything. Every topic I talk about can be done in incredibly eloquent and beautiful way. And everything we talk about can be overdone and ruined and make you look like a freak. So this subject matter is no different. But the idea is really interesting. So Naomi, you and I have known each other for a very long time, and we've developed a relationship whereby which it's safe to say you trust me. And you and I talked, and you had stated listen, hey, Dr. Rahban, I'm fine. Everything is great. You're totally grounded, very normal, very successful. But you said, listen, I'm noticing some things about my face are changing. I'm aesthetically inclined, meaning I like to look my best. And I'm wondering what things we can do or can't do. So as your aesthetic guru, I looked at you, and together we identified a few things that we thought, while you looked good, were subtle but can be improved. And to the average person, if we would have mentioned it to them, they'd be like, well, what are you talking about? But you and I noticed them. So what were those items?
So originally I was interested in the eyebrow lift, but then as we got together, you talked to me about the upper eyelid lift, nose, chin, and the lip lift that we did later.
Did we do anything to your brow?
So we did not do the brow. That is actually originally why I came in for a brow lift, but you kind of made a different plan with me. So okay. I thought I needed one thing, and then you kind of used your expert eyes and we made a new plan.
Well, the reason we did that was because you have beautifully high brows and you wanted a little more open eyes. Sometimes people want a little more open eyes, and the issue is not their eyelids, it's their brow. And sometimes it's their brow, not their eyelids. And it's usually a little bit of both. In your instance, you didn't do it. So essentially what we did for you at 37, whatever, was an upper eyelid bleph, a rhinoplasty, a chin aug, and an upper lip lift. So let's not say anything. We don't know you. No one knows you. We tell someone that. And what is their immediate thought? Like your family members, the people who love you. When you told them that, what did they say?
I mean, they thought I was crazy. Even, it sounds like so much.
Right. It's like, oh my God, what the hell? Plastic surgery's gone off the rails. This person's addicted. This surgeon is crazy. And I would argue with you, if we didn't know you, me, the extent of what we did, it's reasonable to consider that, right? Mm-hmm. So here you are, pretty girl, and you're thinking of doing all this crazy stuff, and you do the surgery. And let's just start out right out of the gates. The people that were like, what are you doing? Why'd you do this? What is their current reaction to you now that it's done? They couldn't stop it. They thought you were going to look like some kind of like, I don't know, what do you call it? One of these magazine train wrecks they put, celebrities like before and afters. Right. Okay, so what are their thoughts now?
That I just look better, refreshed, just like myself, better.
So anybody be like, see, you've ruined yourself. Why'd you do this? Honestly, because there's no point in sugarcoating it. Do you have people, or if people are like, whoa, I didn't think that's okay. All right. Wow. Okay.
Yeah. I mean, I had one person that's like, oh my God, you look so different than when I first met you. But that was like 15, 20 years ago. I have different hair color. I'm thinner. So it's like a combination. So I was kind of offended, but not really. I wanted to look better and slightly different.
What about the people that love you? What did your parents say? What did your boyfriend say? What
everyone
neighbors,
thought
the people that know you,
that I just looked refreshed, that I looked better for sure. My face looks a little bit thinner. I just look more awake.
Okay, so let's talk about this concept. So in general, the more things you do, the additive changes makes you look more different, right? Natural. Like if I come in and I do my nose, I'm going to look one way. If I do my nose and chin, I'm going to look more than I would if I do my nose. If I do my nose, my chin, and so on and so forth. Having said that, that's not just absolute. If I do a dramatic nose job, I will look more different than if I do a subtle nose job, a subtle chinog, a tiny blepharoplasty, and a very, very conservative lip lift. So listen carefully. The idea is not all or none. The idea is how much of what you do. So if I do a little of a lot of things versus one really big item and a significant change, if your concern is about looking yourself, no one noticing, I want to look my best version, it's not true that if you do more things, you look more different. Because in your instance, everything was done so subtly and so mildly that in and of itself, if we had just done that one item, it would be arguable that anyone would even notice. But the sum total of all those things together creates a really beautiful song, right? If you listen to an instrument, a clarinet, it sounds like a clarinet. If you listen to a drum, it sounds like a drum. But if you listen to the guitar, the clarinet, and the piano together, that doesn't sound like instruments. That's music.
Right.
So when I look at you, like your eyelids. So did you have you're Caucasian, and as a result, as Caucasian, and you love the sun, and you're outdoors, you're in Tahoe, you had a little extra skin in your upper eyelids that was blurring out your eyelid crease, right? So you could have left it, but we're there, right? So we took a pinch of upper eyelid skin. What did that do for you when it comes to makeup and your eye shape?
Yeah, it opened up my eyes just enough. And it's super subtle. You would never look at my eyes and think that I had anything done to them.
Right? So all we did was take your eye, which is fine, and we took a little bit of the excess skin that was above your eye, which was kind of like looked a little saggy, and it was hanging on your eyelid. And when you put on makeup, it kind of created a messy whatever. And all we did was get rid of it. So you're exactly the same eye, just a cleaner version of your eye. Arguably, you're 38. Maybe your eye looked like this at 28. Okay? Right. So that took care of your eye. Your nose. Was your nose terrible?
No, my nose was not bad. It had a teeny curve to it from the front. But now I look at the profile and I love it. It's just a tad different. It's cuter. I still have swelling because I'm not that far out of surgery, but absolutely, absolutely love the nose. I actually didn't really even think I would ever get that done. And then I love it.
Right. So your nose was not like some schnoz like my nose. Your nose was a cute nose. Again, this is a matter of personal decision. Someone would say, there's nothing wrong with your nose. There's nothing wrong with anyone's anything. If the argument that people make against plastic surgery is there's nothing wrong with it, this is not a utilitarian surgery. You don't do it because your gallbladder has gallstones in it. You do it because you don't like the way it looks, and when it looks better, you feel better. So there's no one can make this decision. But your nose was good, but it wasn't great. And all we did was change some mild things, change the slope of your nose a little bit, make your tip slightly narrower, rotate your tip just a slightly bit. Right? How much better does that nose look now in comparison?
It looks so much better. I absolutely love the side profile. It looks really nice.
So a small amount has gone so far in you. And then you know my take on chins. I'm a chin fanatic, and your chin was not terrible, right? But
no, there was something that always bothered me about my chin, but I couldn't pinpoint it. I thought it was fat, but you pointed out I actually just needed a little more chin, and together with the nose is perfect.
right, so your chin and your nose, as everyone knows from other segments, are cousins. They're very, very interlinked. Because when you turn to you know, everybody, you have basically two faces, two complete faces, like nothing to do with each other. You have the front face, which is the face you see yourself, and then you have your side face. And had not been for cameras, nobody in the world, like in I don't know, 1850, nobody knew what their side face looked like ever, right? You can't see your side face in a mirror because it's your side face, and there was no cameras. So it's only a modern concept. But you know that you can look at someone who has a gorgeous, beautiful face, and then they turn to the side and you're like, oh my God, what the hell? And vice versa. Mm-hmm. So your side face was good, but your chin to your nose relationship determines everything about your side face. And your chin was a little weak. Same argument we made with your eyelid, same argument we made with your nose. It doesn't have to be terrible to fix it. That's the concept here. Everything doesn't have to be a hammer. Everything doesn't have to be dramatic. Everything doesn't have to be all or none. Things can be slight or subtle, and in and of itself may not be that dramatic, but the sum total of those small changes is like, whoa, you look great. And adding a small chin implant has made you look skinnier, mm-hmm. fitter, more angulated, more model-esque, if you will.
Yeah, absolutely. I love it. It really brought everything together.
Do you look like Jay Leno?
No.
Right, you mentioned the word chinog,
right,
to an uneducated person. Usually the immediate guttural reaction is, oh, no, I don't want to look like Jay. right? Like, okay, well, there's a lot between you and Jay in terms of size and shape and whatnot. So, I that's really the main thing. And I'm happy that you were able to talk about it because, at first glance, we would mention it and everyone's like, oh my God, this girl, she's addicted to plastic surgery. I assure you that if I were to be able to post your before and after, people would be dumbfounded as to how subtle all of these things were. I can post one rhinoplasty that will blow your mind away, and your combination procedures would be more subtle than a single rhinoplasty. Mm-hmm. So everyone has their own path, and you just have to find someone you trust. That's key. That's going to accomplish the things that you're asking them to do. And it's a lot of trust to say, hey, I'm not really unhappy with any of these things, so I don't want a lot, but I would love a little on all these things. Mm-hmm. I would just love a little here and a little there and a little there. That's a fantastic wish list. And we were able to accomplish that.
Yeah, I'm super happy.
I have a question for you. This is important because a lot of people don't live in a bubble. So what that means is that, like, you have a husband, you have a boyfriend, you have a mom, you have a dad, you have a best friend. And when you tell them you want to get something done, they usually freak out. So how did you manage, if I may ask, interacting with the people that you love when you mentioned to them that you wanted to do this constellation of procedures? Did you not tell them until it was done? Did you tell them but only tell them half of it? How did you manage your globe or your sphere of influenced people?
So I only told my boyfriend about my full procedure because he was going to be picking me up from the surgery center and would, have to see me. My two close friends, I just told half truth. I just said I was getting something done, like just my eyelids, I think. I told most people I was just getting my eyelids done because even that was too much for some people. And then one friend was like, oh, you should just get one surgery done at a time, see how it goes. But I mean, after talking to you and making the plan, it was hands down the right decision to do everything because it all went together in one surgery and have it done.
So that's a very good point. So an argument that's made, and it's not a crazy concept. It's like, why do you do all these together? It's so risky. Why don't you do them one by one? So let's just tackle this concept right here and once and for all. So like a mommy makeover, like a facial rejuvenation. Those are two types of. So when you're rejuvenating the face or rejuvenating the body after having kids, you have multiple things that have changed. Okay, in your instance, facial rejuvenation was eyelids and noses and lips and chins and jaws. So the idea of coming in and doing them individually is nuts, because each surgery, your eyelids, each surgery is incredibly inconvenient. Recovery, wound care, time off work, lying to friends, swelling, no gym. I can't go here. I can't do that. Taking antibiotics, blah, blah, blah. You do it all. You're like, holy crap, this looks amazing. Then you go back and you do your chin. Then you go back and do your nose. Are you crazy? Mm-hmm. So the only reason not to do them all, in my opinion, is financial. I just can't afford it. Totally respectable. But the idea is, but it's not safe. What's not safe about it? You're under anesthesia for 2 hours or you're under anesthesia for 4 hours. You're either healthy or you're not. Let's say, for example, you had some heart condition. The answer is not, let's only do your eyelids. The answer is, let's not do any of it. You are not healthy. Let's not do any of these procedures. Conversely, you're healthy. Once you're healthy, you can be under anesthesia for 24 hours. Listen, people, who gets the longest surgeries that are the most complicated? Sick people. People who get transplants, people who get heart valves, people who get sternotomies, people who get craniotomies. All the people who get really gnarly surgeries are sick as shit. So the people that are young and healthy that are getting 4 or 5 hours of surgery is irrelevant. Obviously, you go to a terrible surgeon in the middle of, Mexico, that's a different story. But we're talking about going to a safe surgeon, safe anesthesiologist in an accredited center. So you definitely don't want to do these in fragments, because you just then delay and extend the agony of recovery. So that was interesting that you handled it that way. And I think people often do that, which is they don't tell everybody because they don't want people judging them, right? Judging you like.
Oh, I didn't want to be talked out of something that I had known that I wanted.
Right. So that's powerful. If you're a family member of a loved one of someone, the question is, would you rather support them and help them? Hey, I'm totally down for you to do your surgery. Who are you going to? Let me help you research them. Don't tell them not to do it. Tell them, I'm down. I support you. Let me help you not end up in, a ditch in some foreign country, versus being the naysayer, thinking you're doing them a favor by telling them, no, I love you. You don't need it. Why are you doing this? And then having them doing it and not telling you, because then you don't know what's going on. And then you're totally in the dark. That applies to your children, whether that applies. You're better off telling people you agree and support them and help them do it correctly than to not do it at all. So I think these are such interesting and huge components to plastic surgery. And yeah, I love it that you came here and you helped us kind of tackle this. Any parting, words of wisdom for someone who wants to do some facial rejuvenation? They're a little bit younger. They're worried that people are going to judge them or whatever. What are your thoughts? Any last minute words of wisdom?
I would say just go ahead and do it if you find a surgeon that you're comfortable with, because I'm so happy. I wish I would have done it probably a couple years sooner, just because I don't know, I'm so happy with my outcome. It looks so nice.
Yeah, so that's great. And I think you hit it on the head. If you find someone you trust and you have developed a relationship, it's a journey together. At any rate, we loved having you. Thank you so much.
Thank you.
Always a pleasure. And as always, thank you to everyone who's listening. We do this for you guys. I hope that you gain some knowledge. Share this, download it, tell your friends, subscribe, all the things that you need to do. As always, your host, Dr. Rady Rahban, and I look forward to discovering another topic with you next week.
Thank you for listening to Plastic Surgery Uncensored with Dr. Rady Rahban. We would love your feedback. If you enjoyed this episode, or if you find our podcast helpful, tell us why. Leave us a review and make sure you subscribe on your favorite podcast platform. If you have a topic you would like for us to discuss in an upcoming episode, please reach out to us on Instagram at Dr. Rady Rahban, on Facebook at Rady Rahban, or at RadyRahban.com.